Thumb osteoarthritis. What is it? So in this video, we're just going to have a little bit of a look at thumbs and osteoarthritis of the thumb. So most people aren't aware that the thumb is actually the third most likely place to get osteoarthritis. So the most likely place is the knees and the hips, followed by the thumb joint. And most people think of osteoarthritis mostly in weight-bearing joints, but actually it's extremely common. Slightly more women get thumb osteoarthritis than men, and people with a higher body mass index tend to get thumb osteoarthritis as well. So we're going to have a little bit of a look at what thumb osteoarthritis is and talk a little bit about how we might help it as well. So the main symptoms of thumb osteoarthritis are actually at the base of the thumb, so right down where the thumb joins to the wrist. So what can happen quite commonly is if we watch my thumb close in here, is this gripping type motion puts a lot of pressure onto the base of the thumb here, so people get a lot of pain when they're doing gripping motions or repeated held grips. So common painful tasks tend to be things like gardening or working with repeated grips as well. So as we mentioned, the mainstay of symptoms tends to be down at the base of the thumb. There usually isn't a loss of range of motion of the thumb. As you can see, when I'm moving my thumb even across to my little finger, this joint doesn't move a whole lot, whereas these joints here move quite a lot more. So you tend not to lose range of motion in the thumb, but you do tend to lose strength because of the pain. So what causes the osteoarthritis of the thumb? So the thumb joint here is quite a high load area, so it is somewhere that takes a lot of stress, but it's a lot of other factors as well. So people with a repetitively gripping job can be more prone to thumb osteoarthritis, but other health factors are at play as well. So we do tend to see thumb osteoarthritis in women. We also tend to see it in people with a high body mass index, so people who are overweight, especially abdominal fat, tends to increase the risk of getting thumb osteoarthritis. Previous injuries such as fractures in the hand or the wrist can predispose people to thumb osteoarthritis as well. So what can we do to make that feel better? One of the things we can use is what we call topical anti-inflammatory. So these would be anti-inflammatory creams that you would put onto the area, but what they do is they reduce some of the inflammation around the area and can make the osteoarthritis feel better. So things like diclofenac cream or ibuprofen cream applied to the area as directed by the instructions can be useful. I should say, if you are going to start doing that, then you should consult a doctor or a physiotherapist or a healthcare provider prior to starting that. Other things that can be helpful are splints, and you can get some really quite small splints that will support the base of the thumb, so they tend to wrap around the wrist and then come up and wrap around the thumb as well. These are often made of things like neoprene and they have Velcro straps on them, and to be honest, cheap ones are just as good as expensive ones. They don't have to be particularly rigid, just something that will support the base of the thumb, so as you're doing your gripping activities it takes some of the load rather than your thumb joint. Exercises can also be helpful, but be mindful that you're not aggravating the symptoms as well. So we're going to look at things like gripping and increasing the strength of grip, but also in the opposite direction. So spreading the fingers, so getting an elastic band or something similar and spreading the fingers and the thumb against that. Gripping a ball or a putty or anything that you can find that's a bit squashy that you can grip against is very good. An individual strengthening of the thumb, you can do that quite easily. You just get your other hand and place it on top and then resist up against. So imagine I'm pushing down against my thumb and I'm resisting the extension of the thumb there, and the same with the opposite direction. And sometimes you can find that these static motions, rather than moving through range, the static motions are much more comfortable. Finally, a good tip for anybody with thumb pain is if you are doing something where you're repeatedly gripping or it requires quite a strong grip, then thickening the thing that you're gripping can be very helpful. So if we look at my thumb again now, let's get my finger and look at how much the thumb has to move to grip the finger. Whereas if we put all 4 fingers in here, so it's much larger, the thumb does not have to move quite so much, and this really deloads that base of the thumb area here and be quite a lot more comfortable. So think about getting thicker handles for gardening tools or anything that you need to use with repetitive gripping. So hope you found that useful and you've had a really good look at my hand, and that has helped you with osteoarthritis of the thumb and some tips there to try and reduce some of the symptoms. Don't forget to hit the like and subscribe buttons, and you'll see other videos that I create along the way.